Question 1. A 60-year-old woman receives a plasma transfusion. 1 hour later, she develops acute respiratory distress with hypoxemia and bilateral pulmonary infiltrates on chest X-ray. Her blood pressure is normal, and there are no signs of volume overload. What is the most likely diagnosis? A. Transfusion-associated circulatory overload TACO. B. Acute hemolytic transfusion reaction. C. Anaphylactic transfusion reaction. D. Transfusion-related acute lung injury. E. Febrile non-hemolytic transfusion reaction. Answer D. Transfusion-related acute lung injury. Explanation. TRALI presents with non-cardiogenic pulmonary edema and respiratory distress within 6 hours of transfusion. It is caused by donor anti-leukocyte antibodies that activate recipient neutrophils in the lungs. A. TACO causes cardiogenic edema, often with hypertension and volume overload. B. Would present with fever, hemoglobinuria, and hypotension. C. Anaphylaxis causes hypotension and wheezing, not pulmonary edema. E. FNHTR has fever and chills without respiratory symptoms. Question 2. Which of the following best describes the pathogenesis of TRALI? A. IgE-mediated histamine release by mast cells. B. Complement-mediated lysis of RBCs. C. Two-hit neutrophil activation leading to increased capillary permeability. D. Preformed cytokines from donor leukocytes. E. Delayed cytotoxic T-cell response against donor HLA antigens. Answer C. Two-hit neutrophil activation leading to increased capillary permeability. Explanation. TRALI involves a two-hit mechanism. 1. Recipient neutrophils are primed in the lung vasculature. 2. Donor anti-leukocyte antibodies activate them. Inflammatory mediator release. Capillary permeability, non-cardiogenic pulmonary edema. A. Describes anaphylaxis. B. Acute hemolytic reaction. D. Describes febrile non-hemolytic transfusion reaction. E. GVHD, not TRALI. Question 3. Which transfusion product is most commonly implicated in causing TRALI? A. Washed red blood cells. B. Platelets from male donors. C. Fresh frozen plasma from multiparous women. D. Cryoprecipitate. E. Irradiated red blood cells. Answer C. Fresh frozen plasma from multiparous women. Explanation. Multiparous female donors are more likely to have developed anti-leukocyte antibodies from prior pregnancies, which can trigger TRALI when transfused in plasma-containing products, like FFP. A, B, D, E, less likely to be involved. FFP from multiparous women is most associated. Question 4. A patient develops acute hypoxemia and bilateral infiltrates within 3 hours of receiving a transfusion. Which of the following findings best distinguishes TRALI from TACO, transfusion-associated circulatory overload? A. Bilateral pulmonary infiltrates on chest X-ray. B. Elevated BNP. C. Dyspnea. D. Fever. E. Tachypnea. B. Elevated BNP. Explanation. Brain natriuretic peptide is elevated in TACO due to volume overload, but normal or low in TRALI since it's not cardiogenic. Both can have similar symptoms, but volume status and BNP help differentiate. A, C, D, E, seen in both TRALI and TACO, not specific. Question 5. Which of the following clinical steps is most appropriate in the initial management of suspected TRALI? A. Stop transfusion and administer furosemide. B. Continue transfusion with slower rate. C. Administer diphenhydramine and resume transfusion. D. Stop transfusion and provide supportive oxygen therapy. E. Administer epinephrine IM immediately. Answer D. Stop transfusion and provide supportive oxygen therapy. Explanation. TRALI requires immediate cessation of transfusion and supportive care, e.g., oxygen, ventilation if needed. Diuretics are not helpful since this is non-cardiogenic pulmonary edema. A. Furosemide helps in TACO, not TRALI. B. C. Never continue transfusion during suspected reaction. E. Epinephrine is for anaphylaxis. Would you like